Our presentation is on the ligaments of the wrist. The wrist is made up of 8 small carpal bones which are labeled in this image. The wrist joint is made up of 4 bones. 3 of those bones are the proximal carpals, which are the scaphoid, lunate, and triquetrum, colored in orange, and the distal end of the radius. Together with the articular disc, they make up the radiocarpal joint. There are 4 main ligaments of the wrist that stabilize and move the wrist in flexion, extension, adduction, and abduction. A ligament is made up of fibrous connective tissue and it connects 2 bones together. First, we have the palmar radiocarpal ligament, which is located on the anterior side of the wrist and it has 4 parts to it. Going from lateral to medial, we have radioscaphocapitate ligament, the long radiolunate ligament, the radioscapholunate ligament, and the short radiolunate ligament. They originate on the anterior distal border of the radius and insert on both rows of the carpal bones. Its action is to allow the hand to follow the forearm during supination, to stabilize the wrist, and to prevent overextension of the wrist. Next, we have the dorsal radiocarpal ligament, which originates on the posterior distal border of the radius and inserts on both rows of the carpal bones. Its action is to allow the hand to follow the forearm during pronation, to stabilize the wrist, and to prevent overflexion of the wrist. Here we have the ulnar collateral ligament, which originates on the ulnar styloid process and inserts on the triquetrum and pisiform bones, and it prevents the wrist joint from extreme lateral movement. Lastly, we have the radial collateral ligament, which originates on the radial styloid process and inserts on the scaphoid and trapezium bones, and it prevents the wrist joint from extreme lateral movement.
Scapholunate interosseous ligament is a small horseshoe-shaped ligament between the scaphoid and lunate bones and is one of the most commonly injured ligaments of the wrist. This injury leads to wrist instability and can misalign the carpal bones, as the SLIL is a joint stabilizing ligament. It is a common injury in athletes such as football players and gymnasts and often occurs when the wrist is in an outstretched position, such as during hyperextension, intercarpal supination, and ulnar deviation of the wrist. The injury is quite serious and can have long-lasting effects. An SLIL injury can cause abnormal kinematics and loss of carpal alignment. Therefore, it can impact load transfer across the wrist joint. Without treatment, this injury can progress to a very painful form of osteoarthritis called scapholunate advanced collapse. So it's crucial to treat this injury early. In this image, MR orthography gives a direct view of the injured ligament. This is an MRI where fluid is injected into the wrist, and it's commonly used for wrist ligament injuries as it provides great soft tissue resolution, is a tear of the scapholunate ligament, and is indicated by the red arrow. Early diagnosis is crucial, but it's difficult to diagnose. Weakness during gripping is a common symptom of a chronic injury. If diagnosed early, less invasive surgical approaches can be taken and non-surgical options can be explored. But if the injury becomes chronic, more invasive surgical approaches will be taken with worse functional outcomes. Thank you for listening.